Imagine waking up one morning and realizing that a silent disease has been growing inside you for years, without a single warning you could recognize. Critical colon cancer symptoms you should never ignore. Why are cancer rates, particularly for colon cancer, rising, and not just among the older population, but increasingly in younger people as well? Today, let's explore this concerning trend and provoke a meaningful debate. Make sure to watch until the end, because there's a list of the most common colon cancer symptoms that you might be experiencing. Colon cancer ranks as one of the most devastating diseases today. It is the third most commonly diagnosed and the second most fatal type of cancer. But what makes the fight against this disease even more complex is the formidable industry that has been built around it, an industry driven by money, misleading ads, and so much confusing information that it leaves both patients and healthcare professionals puzzled and often wrong. A common misconception is that your risk for colon cancer is primarily determined by your genetics. While it's true that having a family history can increase your risk, accounting for 5 to 10% of cases, this is far from the complete picture. Genes may load the gun, but it's our lifestyle choices that pull the trigger. In this context, modern research is increasingly highlighting the impact of diet and lifestyle as key factors in preventing or even reversing the disease. Foods rich in antioxidants, for instance, are now being acknowledged for their role in fighting various chronic conditions. This isn't mere speculation, it's a fast-growing area of scientific research that shows where medicine is headed in the future. How to know if you have colon cancer? What are the early symptoms of colon cancer? What symptoms indicate advanced stages of the disease? How can you detect it early? What exactly is a colonoscopy? And who should consider having one? What are intestinal polyps and how can they be prevented from turning into cancer? Most importantly, are there natural ways to prevent and combat this condition? Contrary to what many believe, this type of cancer often eludes detection for a long time, sometimes years. It typically starts as a small, slowly growing polyp on our intestinal wall. Initially, it occupies minimal space and doesn't interfere with the intestine's contents, which is why it doesn't produce symptoms in the early stages. Therefore, those at higher risk, especially individuals over 45 or 50, are advised to undergo a colonoscopy. The recommendation comes even earlier if you have first-degree relatives who have had cancer. With a colonoscopy, you can visualize, detect, and remove polyps. The appearance of symptoms often depends on both the size and location of the tumor. Interestingly, colon cancer growing on the right side of the intestine can be more elusive. This is because the feces are still liquid at this stage, the intestine hasn't absorbed all the passing water yet. As a result, it's difficult for a tumor to obstruct the intestine at this point unless it is very advanced or has metastasized to other organs like the liver, bones, or lungs. Let me offer a tip for early detection. Tumors often grow in a disorganized way, causing them to bleed. The issue is that this bleeding is not visible. One early detection method involves analyzing stool samples for hidden blood. A stool sample is taken and sent to a lab for analysis. Colonoscopies are also effective for early detection, but watch for these warning signs. Chronic bleeding can result in iron deficiency anemia. If you're around 45 or 50 years old and look paler than usual, coupled with iron deficiency anemia, you should be evaluated for an intestinal tumor. Sometimes stool may appear darker due to slightly more intense bleeding. Now let's consider colon cancer that occurs on the left side of the intestine. Obstructions, or intestinal occlusions, happen earlier here because the feces are already solid. There's less water compared to the right side. So what symptoms might a person experience? Before we further explore the following colon cancer symptoms, don't forget to subscribe to our channel and activate notifications to stay updated with our informative videos. One common symptom is a change in bowel habits. Suppose your normal routine involves going to the bathroom daily or once every 2 or 3 days. If you find yourself becoming more constipated recently, not having bowel movements for 1 or 2 weeks, this should raise suspicion. In other instances, the shape of the fecal matter may change. It might become thinner as it passes through this area of the intestine. Alternatively, you could experience episodes of diarrhea alternating with periods of constipation. Many people experience chronic diarrhea, prompting doctors to consider performing a colonoscopy to check for the presence of an intestinal tumor. When the tumor grows to an advanced stage, It produces an image on an X-ray resembling a bitten apple. Specifically, this image shows the narrowing of the intestinal lumen due to the tumor. As a result, feces have difficulty passing through this narrowed section. The tumor can also cause bleeding. Unlike the hidden bleeding in earlier stages, the blood here is often bright red and visible. The stool may also appear darker due to the presence of blood. Similar to right-sided colon cancer, other symptoms indicative of more advanced cancer include abdominal pain from obstruction-induced gas buildup, abdominal swelling, weight loss, fatigue, and chronic tiredness. Symptoms could also manifest in internal organs such as liver pain from metastasis or shortness of breath if the lungs are affected. That's why the next information on how to detect this condition early, and most importantly how to prevent it naturally, is crucial.